Yep, I'm here.
I can hear you. You are live on the air. Thanks for joining us here on the Big 550 KTRS here in St. Louis.
Thanks for having me.
Your book is called High Price, and we were just telling people your story. Your story is quite remarkable, but your scientific studies are even more remarkable. Tell us what you did with these studies trying to figure out the effects of cocaine and methamphetamine on people.
Well, I guess the studies that you're talking about were based on studies in laboratory animals where people had showed that if you allow an animal to press a lever to receive intravenous injections of drugs like methamphetamine and cocaine, they would do so until they die. However, if you provided other things in the cage with the animal other than the lever to press for cocaine or methamphetamine, something like a sexually receptive mate or some sweet treat, you find that the animal take those other options more often than the drug. And so we thought it would be interesting to do the same thing in humans, provide alternatives that were not drugs, a choice between something like $5 or $20 and crack cocaine or methamphetamine in methamphetamine addicts or cocaine addicts. And what we found was that $5 changed the selection of cocaine or methamphetamine to about half of the time. But when you offer $20 as an alternative, they almost never took the drug.
Which is fascinating because it flies in the face of everything that we think we know about drugs, including, Doctor, I got to say, this is hard for me to understand because you give $20 to a crack addict or somebody suffering from methamphetamine, they're going to go take that and then buy the drugs with it.
Yeah, that's a great point. These studies last from anywhere 2 to 4 weeks. And so that means that they had to save up their money, wait. That means that they had to plan, engage in long-term planning, engage in delayed gratification, all of these things that we said addicts couldn't do. So I don't know if they took their money and went out and bought crack, but I do know that some of them didn't, because some of them I actually paid some bills with their study earning. They asked me to write checks for various bills. But the point is that in any event, even if they did go out and spend the money on drug, it flies in the face of what we said about crack cocaine addicts or methamphetamine addicts in terms of their cognitive functioning. You have to exercise high levels of executive cognitive functioning in order to plan to do that. Save up your money, delay gratification. Those are complicated cognitive functions.
You also say that, and this also doesn't make any sense to people, you also say that most people who try drugs don't get addicted to them.
Well, most people should think about the last 3 occupants of 1600 Pennsylvania Avenue, the White House. The last 3 guys who occupied the White House all tried drugs, used drugs. Bill Clinton, marijuana. George Bush, marijuana, widely suspected of cocaine. Barack Obama, marijuana and cocaine. All 3 of those guys have contributed greatly to the country, and they didn't become addicts. That's the normal drug user.
What about methamphetamine?
What about methamphetamine? About 5 to 10% of the people who ever try methamphetamine become addicts. So that means that 90% of the people who try methamphetamine don't become addicts. Understand this also. Our military has been given essentially methamphetamine to pilots and people who work extended shifts for at least 60, 70 years, since World War II. And think about all the kids and the people who are on Adderall for attention deficit disorder. It's essentially the same drug as methamphetamine. And they are not addicted, and many of them are doing better as a result. And so I think that when we think about methamphetamine, many people think of shows like Breaking Bad, which is great TV drama, but it's not reality. And people need to separate fact from fiction. Fiction is great for entertainment, but it's not reality.
The book is called High Price. It's now out in paperback. It is a must-read. Dr. Carl Hart, we are in the grips of a heroin epidemic in this country. Does heroin and your research with heroin coincide with the other research from the other heavier drugs?
Well, first of all, we're not in the grips of a heroin epidemic. That's one thing people have to understand, because when we think about how we measure who's using heroin, when we look at who's used heroin at least once in the past year, yep, that number has increased over the past 10 years or so. It certainly has increased. Now it's about 600,000 people every year who's used it at least once. It used to be 300 to 400,000. So that has definitely increased. But when we look at who is currently using the drug. We define current users as the past, at least once use in the past 30 days. That number has actually gone down since 2007 or so. And so people, whenever we have high profile deaths or these sorts of things, we certainly have had a few in terms of heroin. People begin talking about an epidemic. Heroin use has always been relatively low. That number has always been considerably lower than marijuana, considerably lower than cocaine, and it remains considerably lower than all those other drugs. And so it's not an epidemic. So I think people are misinterpreting what's happening.
The book is called High Price. Dr. Carl Hart, too much to go through here. That's why you wrote the book. The book is part memoir, part science, and your own story is interesting in and of its own right. But what's the bottom line here going forward? What do you want people to know about addiction and about drugs and about the war on drugs and what's going on now?
The bottom line is this, is that our focus on addiction is probably misguided. There are the vast majority of people who use drugs, 80 to 90% of them don't become addicts. And so that's not where the action should be. And we shouldn't allow that to determine our sort of thinking about what these drugs do and don't do. That's number one. Number two, our approach to dealing with drugs in this country has been misguided. And it's been so misguided that we have spent a lot of resources and we've also put a lot of people in jail as a result. And so I am arguing that we should reconsider the way we are regulating drugs such that we don't punish so severely members of our society. Imagine this. If George Bush, Bill Clinton, or Barack Obama would have gotten arrested for drug possession, which, by the way, we arrest about 1.5 million people a year, every year, those guys would have never been able to make a contribution to the country. I am asking people to reconsider what we're doing so we can have more people contribute to the tax base by not giving them a criminal record where it decreases their chances of getting jobs.
Would you be in favor of legalizing some drugs?
Certainly, when you say legalization, you mean regulation like we do alcohol or tobacco. Yeah, but we have to look at those things individually and carefully. I certainly would be in favor of it as long as we are thoughtful about what we do.
Dr. Carl Hart, not enough time, but that's why you wrote the book. It is a fantastic read and an unbelievable story about how you rose from the streets of Miami to be a professor at Columbia University, and you're a highly controversial and yet really well-respected research in the book High Price, now out in paperback. Dr. Carl Hart, thank you very much for your time.
Thank you for having me.
You got it. 7:31 here, Big 550.